Hi, I guess I will just introduce Dr. Mary Elliott. Dr. Mary Elliott is a psychiatrist and a psychoanalyst at uh, Princess Margaret Hospital here in Toronto. She focuses on mindfulness. She has spoken at our conference before and has always been incredibly engaging and incredibly thoughtful in how she approaches um, her patients and the work that she does. So I will not take much more time. Dr. Mary Elliott, thank you so much for being here and for speaking to us.
Oh, I'm so delighted to have this opportunity to meet with you today, and I really feel grateful and honored to have the chance to share some of my ideas around fostering resilience and well-being during these challenging times. And I think actually it's so beautiful how things interconnect. Like one person wasn't available to introduce me, and Teresa resiliently just showed up and did it. The other thing, I just really feel like I was touched by that video, and a little bit of what I will eventually come to focus on in this talk is how resilience is something that we can grow. And one way we can grow it is to acknowledge our experience. And so I think actually I wasn't planning to do this, but this is a perfect time to do a little transition called the RAIN practice. And RAIN is something we can use when an emotional storm hits. And I've been in a trauma training for the last 2.5 days. So I'm already a little bit activated, I would say, and then watching that video. So RAIN is this acronym, and I'm just going to walk you through it if you want to do it to sort of just notice what emotions came up when you watched that beautiful tribute. Then go ahead. And if you don't want to do this, that's fine. I'm just going to take a minute. So let's just begin by grounding your feet on the floor and noticing your breath, just taking a few easy breaths, breathing in through your nose and out through your mouth. That just helps us to regulate our system. If we just turn to the breath, feel the nourishment of a long, luxurious in-breath and a slow, easy out-breath. And then perhaps recognizing the R in RAIN, recognizing how that video landed for you, acknowledging whatever emotions came up, sadness, fear, or any host of emotions. And then just notice how it's affected you. What happened in your body? Was there contraction? Were there tears? Is there a pit in your stomach? Jitteriness? Whatever came up in the body, any emerging emotions, and any thoughts. I miss that person. That's sad. That's something I worry about. That's something I fear. Whatever came up. And then we just turn and nourish ourselves with compassion. This is hard. This is challenging. You're not alone. Maybe putting a hand on your chest, maybe taking a sip of tea or water, whatever you got during the break. And then just coming back to your breath. That's the RAIN practice, just allowing those emotions to flow through. So, which leads me to say, I'm going to turn to the presentation now. Okay, whoops. And so I, being an internal optimist, was hoping that the pandemic would be over when this conference came along. at the point where I was initially asked, but I thought I would wait to decide what I was going to talk about until we were a little closer to the conference. And that's what landed me on this topic of fostering resilience and well-being during challenging times, because I really want to acknowledge that not only are you going through an experience in the cancer system, you're doing it at this time when the cancer system has been turned upside down during the pandemic. And so it adds this whole other layer, at least from my observation and my experience in working with patients. So I want to acknowledge the extraordinary set of circumstances, the added stressors that you may be experiencing. And so this has led me to this talk where I'd like to introduce to you a trauma-informed approach to understanding the stresses and psychological distress associated with undergoing medical care during a pandemic or at any time, and any other stressors you're experiencing in your life, to review some of the practical ways, like what we just did with the RAIN practice, to help you regulate and to foster this sense of resilience and well-being, and to also remind you you're not alone. You're all here, so you're part of a community. And sometimes there's this community and multiple other communities that, or teams, including the healthcare system, that can offer you further assistance and support. So I don't even know if you can read this, but that's okay. What I want to just set up is that we're not just talking about post-traumatic stress when we talk about trauma. Trauma is an experience. There can be a sense of a traumatic stress that is severe fright that we experience when we're confronted with sudden, unexpected, or potentially life-threatening event over which we have no control, and to which feel we're unable to respond effectively, no matter how hard we try. So there's this shock to the central nervous system, where it may feel overwhelmed because of these threats. And just to highlight that in the CAMH definition, the part of their definition that I'm interested in is the experience of a traumatic event can harm a person's sense of safety, sense of self, and ability to regulate emotions and navigate relationships. And so in this talk, I want to give you a way to kind of conceptualize stress, because if we have words and a system to put to noticing our stress, a system, then sometimes it helps us to recognize the stress, to name it, and what we name, we can then tame. And so having this method, I hope will be helpful. And also just the recognition, as I'm sure you've all experienced, that stress isn't a single thing, that it's dynamic and it unfolds, and it's multifactorial, and it can be affected by personal circumstances and our own personal narrative, our personal history, relationships, social contexts, systems contexts, perceived threat, etc. And so I really love this acronym from the University of Montreal that they call stress ingredients NUTS. And that is novelty, unpredictability, threat to ego, and sense of self. And again, when you think about going through a medical experience, having a medical experience, and that makes we all know it's not a single event, right? When somebody has stomach cancer, it's a whole, dare I use the word, journey, and so novelty being something new, not previously experienced, that is a stressor that comes up again and again along the way of a medical experience of stomach cancer. the unpredictability, something you had no way of knowing would occur. Recently, it made me think that recently I said to a patient of mine, the only thing that's predictable is that it's predictably unpredictable. And I'm sure Dr. Alamova has used that phrase before. I think we learned that in medical school in terms of certain kinds of situations that we deal with. Then there's the threat to ego. And by that, we mean something that threatens our sense of self, the body image, the social roles, our sense of self-efficacy, our life goals, all kinds of ways in which the sense of self is impacted by the experience. The sense of control, situations which we feel we may have little or no control over. And so also just recognizing these things means that we can address them. And even when it's sense of control, we can look at, where do I have control? And we'll talk a little bit about that. So how this all fits with trauma is that, we kind of, in a simplified way, look at the brain in these three sections. One is executive functioning, and that's the part of the brain that helps us plan, use reason, logic, problem solving, self-monitoring, self-regulation. We're able to learn and grow and follow instructions. But there's also this emotional, the limbic system part of the brain, where there's emotion, arousal, and some memories are held. And then there's the survival state at the brainstem. And that's so at the brainstem level, where it's about safety and survival, that gets triggered when we're stressed. So when those elements of nuts come up, if we're not prepared and we don't maybe have the tools, we can be triggered into a survival state. And when that happens, whoops, I was advancing on my own computer rather than this little green. When that happens, what you see is that the brainstem sort of shuts down the prefrontal cortex, that part of the brain where we have executive functioning. And so just to give one example, sometimes people tell me that they were in an appointment and they don't remember anything that was said. And that makes perfect sense, because the body is so busy just trying to survive with the stress that the prefrontal cortex is turned off. When we're really super anxious, we aren't able to access all of those important elements, all of those important functions of the prefrontal cortex. So, not wanting this to be, no pun intended, too heady, I think it's helpful to see that this is the body's way and the body's sort of primitive functioning in relation to trying to help us survive. But in the cancer system, it's not so helpful, right? If we can't be present to problem solve and ask questions and to think flexibly and to self-monitor and to regulate our emotions and learn and follow instructions, etc., that can really significantly impact us. So the other part about when stress is activated is that we have the stress response syndrome system, where various hormones are released, again in a way that's meant to be adaptive and to support us through a crisis. And we also have the autonomic nervous system at play. And I'm really going to be talking to you about that, because that's something that we can begin to really monitor and then respond to, and then come back into a state of regulation. And I should say that I've been talking about some of these things a lot to healthcare providers and to other people during the pandemic, because we've all been perhaps thrown off course by these extraordinary set of circumstances, by having for all kinds of different reasons. And I don't want to get into that. That's a whole nother talk. But basically, again, this is from the University of Montreal, which has a wonderful center called the Center for Studies on Human Stress. And it's a great website if anyone wants to look it up. But you see here that, I don't know, yeah, you see here that under optimal conditions, healthy stress response is that levels of stress hormones in the autonomic nervous system kicks in to meet the demands of the situation. And then once the stress leaves, they go down. But when we're under chronic stress, pandemic, various aspects of being in the cancer system, and it can be when we're initially diagnosed, it can be during a period of treatment, it can be when we're sort of declared disease-free and we're grappling with uncertainty and fear of recurrence. It could be if there's a relapse. There's all kinds of different reasons. It could be when we're trying to juggle the various aspects of life that still are existing: finances, relationships, kids, jobs, etc. So what can happen there is you can either have these chronic hits of stress response, and that can actually even happen until the point where you're not mounting full responses. So it might not be very obvious on this graph, but we're actually not getting the full stress response. So we're not getting the full adaptation. Sometimes that stress response gets turned on and does not turn off. And that's where you stay in this high state of hyperarousal and anxiety and emotional distress. And sometimes there's been so many hits that we can't mount a response anymore, and we just flatten. And so, at the beginning of the pandemic, just to use that as an example, lots of people became stressed and just stayed up there in this state of hyperarousal. And then now what we're seeing is much more flattening. Like, people have flattened out to the point of being almost or sometimes in hypoarousal. So just important to recognize this. So there's this fancy term called the polyvagal theory, which is a theory about stress and trauma that was proposed by a researcher in neurophysiology, who says that there's usually these three responses, these three components to the polyvagal theory. One is that we're a socially engaged system, and in a socially engaged system, we co-regulate without even knowing it. Being around people, and I heard some conversation about this on your break about even healthcare providers who are able to, just by their very presence and demeanor, help patients to co-regulate, to just help them ground. But we're all doing it all the time for each other. And that can help us. It's a reciprocal regulation that's controlled by our autonomic nervous system to help us feel safe, secure, and a sense of trust. And this concept of neuroception is that it's outside of our awareness. It's called detection without awareness. It's happening at that brainstem level, like this, like in a flash, faster than I can snap my fingers, actually. And so the autonomic nervous system responds to sensations coming in that can either be coming in from external sources or coming in through the body. So if you get a rapid heartbeat, because you've been jumping up and down, you may be able to, initially you may feel like, ooh, what's wrong with my heart? And then you realize, oh, I was just exercising. But sometimes when it's happening at that very in a rapid way, our body sensations may be interpreted as danger, right? Rapid heart rate, gurgling in the stomach, signs of hypoarousal. That's signaling us into a state of that there's danger. So we leave the social engagement part of the autonomic nervous system, which is the myelinated part of the vagal nerve, the wandering nerve, and we go into either mobilization, the sympathetic adrenaline driven autonomic nervous system, or we go to what's called the dorsal ventral, which is immobilization, which is a little different than freeze. Immobilization is when we actually feel this sense of collapse. So we have these different areas in the polyvagal system. And what's important here, I'm not going to go over all of this except to say that to be in when we're reading for signs of danger, and again, this is out of our awareness, we're reading people's facial expression, we're listening for their tone, we're seeing their eyes. And so we're just kind of reading the whole body language. So using voice, eye contact, facial expression, that's so important. And just think about, when I think about people and I see people in the cancer system right now, we've lost a lot of that. Hopefully, we've all become good at reading eyes. And I love that they made these emojis. I don't know if you get a copy of my slides, but I went through and found all these different emojis that made me start thinking and really tuning in to people's eyes, because we've lost somewhat some things in the voice, because I know when I'm seeing patients in person and I've got a mask on, I speak louder, I speak differently than I normally speak. I feel like sometimes I'm losing some of the attunement that I want in my voice. And also people aren't seeing my mouth. So I think that it explains why there can be more activation in the system right now. And so just to review, the ventral vagal system tells us that we're safe, we're socially connected, we feel healthy, we can grow, there's creativity, positivity, explore and engage. The sympathetic is we're really mobilized and hyper aroused, fight, flight, freeze, cry for help. And the parasympathetic nervous system, dorsal, is in a healthy way, rest and digest. But when it's overwhelmed into a state of hypoarousal, we zone out, we numb, we withdraw, we fold, we shut down, we collapse, and we disconnect. It's important because what we really want to be doing is we want to be using our monitoring of where am I in this system. We call it a ladder. So the ventral vagal, where we're able to regulate and feel safe and secure, is at the top of the ladder. In the middle is that hyper arousal, and then at the bottom is the hypoarousal. And so we want to be able to be engaged, to have this physiologic equanimity. And there is this sympathetic drive that's adaptive, right? That some of it is good, right? It gives us interest and curiosity and to explore and learn new things and enthusiasm. When there's too much and the fear is not regulated, that's when we go to fight, flight, freeze. And similarly with the parasympathetic, sometimes we do need to just relax, totally go into daydreaming, napping, falling asleep, etc. But if fear is not regulated, we end up in this submit, collapse, fold, even can faint and become numb. So we call that the window of tolerance. And basically, this slide is just really, we can ask ourselves, where am I? Am I outside? In the center part here is when we're in the optimal arousal zone. And that's when there's a good flow. If we're hyper aroused, we're outside of our window. If we're hypo aroused, we're outside of our window. And we can get back into our window by using certain techniques. If we're hyper aroused, take a minute. Think, what do you do if you're feeling extra agitated? Well, the one thing that we can do in either of these is to use support people, right? A partner, a peer, a good friend, a healthcare provider. We can also use breath. We can use music, soothing music, calming, hot baths, that sort of thing. When we're hypo-aroused, we need to bring energy into the body a little bit and come out. I have one patient who says whenever they're waiting for results, they turtle. I love that image. It's not so pleasant, but they just are so fearful that they withdraw and they feel like a turtle. So with that person, exercise, singing, music, reaching out to friends, things that really bring activity into the body, yoga, progressive muscle relaxation, those sorts of things to really get energy back into the body can be so helpful. The other thing that we can always be monitoring for and do is to make sure that we're seeing what kind of coping is really going to be helpful to us. And so Folkman and Greer came up with this system many years ago. And John Hunter and Bob Maunder at Mount Sinai actually just wrote a book called Damaged. They've focused a lot on Folkman and Greer's work, and along with pre-existing trauma and stressors. And they put together this little YouTube video. You can just Google Maunder and Hunter and put in coping, and you'll get they call themselves the Men in Plaid, and a nice little video of how you can use these coping mechanisms. But basically, there's problem solving. That's where we look at what is the issue here. Why am I feeling so activated? Or what's driving me into this state of hypoarousal? So we can brainstorm, commit to action, and try to solve problems. We can also reach out for support in this place as well. So this is about getting information, collecting information, and communicating with people. Support groups often are problem focused. There's also emotion focused. Sometimes we just have a lot of emotion built up, and so we want to be able to recognize that emotion, to validate it, and that helps us to learn to tolerate it. And if neither of those work, we also can use meaning focus. Like, what gives us a sense of purpose and meaning? What is still true in our lives, And are we using spiritual resources as well? What are our values? We can still live by our values. So these are ways of coping. So when it comes to resilience, Valiant said a resilient individual resembles a twig with fresh green living core. When twisted out of shape, the twig bends back but doesn't break. Instead, it springs back and continues to grow. We say that it's the capacity to bounce back under pressure, unpredictability, and adversity, right? Responding to those stressors in an adaptive and effective manner. And that's where we can use this recognition of our experience so that we can respond to it. We created a resiliency program that has 6 domains of resilience, and self-awareness, I just want to say, is in the center, because if we're aware of our experience, we can respond to it. So please, even if you're feeling really emotional, depressed, or anxious, know there's help. So by recognizing what your experience is, you can then respond to it and hopefully respond with compassion. We also talk about self-regulation, the fundamentals, right? Getting enough sleep, exercise, nutrition. And I know nutrition is a particular sticky point when dealing with stomach cancer. And then there's also connectedness in every type of resiliency and coping program. Connectedness is so important, as is perspective, and we aim towards optimism. So again, we can use this autonomic ladder to say, where am I? So we can recognize our awareness, respond, regulate, and reset by using these different techniques: breathing, a breathing space, a body sweep, progressive muscle relaxation, fundamentals of self-care. I want to just say 2 other things, and that is that, again, this idea of social support, and social support comes in many different ways. But first, I do want to say it is in the shelter of others that people live. And I've heard this quote said in an updated way as, it is in the shelter of others that people survive. And our listening creates a sanctuary for homeless parts within another. So we really do these beautiful, we give each other gifts by listening, by being there, and validating. Sometimes you may have friends or family members who seem to have checked out. They disappear because they don't know how to support you. Sometimes it's really important to recognize that people can give support in different ways. So it's worth reaching out. If you need your car fixed and you don't have time to take it in, reach out to someone who can't provide emotional support. You can really begin to use people in different ways. This organization provides emotional support, educational support, connection to the appropriate caregivers. So there's lots of different ways to obtain support. It's not just about who you live with. And it's also not about how many people you have. It's about recognizing that we each need different things, and where can I get that from? And then the last thing, how I want to end, is on this note of optimism, which is, Winston Churchill said, the optimist sees opportunity in every danger, and the pessimist sees danger in every opportunity. And I want to say that optimism ignites resilience, providing the energy to power the other resiliency factors, and facilitates creative, active approaches to coping within challenging situations. It acknowledges that there are bad and good outcomes. It's not just about taking stress away. It's about accepting our limits and also being future-oriented. And it's related to when we can be optimistic, and which fuels resilience. It's related to happiness, positivity, hope, and associated with physical and mental well-being. And we can develop this by checking and being aware of our sense of meaning and purpose, spirituality, gratitude, joy, awe, humor, positive psychology of reframing. So something that's a simple way to engender optimism is to do the gratitude practice where each night you write down 3 things you're grateful for. And over a 2-week period, what they found in studies is that people have higher scores in terms of positivity and lower scores in terms of depression. So that's so important. All of these things can lead to post-traumatic growth. So resiliency can help us lead to personal strength, new perspectives, new appreciation, spirituality, and deeper relationships with others. And please don't hesitate to reach out. If you have persistent distress, symptoms impacting your ability to function or feel suicidal or hopeless, many concurrent stressors, symptoms, other symptoms, please reach out to your healthcare provider and get the right connections, whether it's to a psychosocial team, a psychiatrist, a nutritionist, pain and palliative care specialist. I just want to once again thank you for this opportunity. And this is a picture that came from the big picture competition that was put on during the pandemic for kids. And I love this one. We're all connected by our hearts, no matter how far away we are. So I'll end there.
Please. So I have a question from Anna. So she's asking, we have drugs to treat depression and anxiety. What about scanxiety?
Yeah. So what I would say about scanxiety is that there's the pre, during, and post, right? So many people tell me it's not the actual scan. For some people, it is the actual scan. It's being in an MRI machine, a PET scanner, a CT scanner. But for some people, it's waiting for results. And very often now results come quickly, but so a few things. The lead up to the scan, people may notice a lot more physical symptoms because often we're in a hypervigilant state when we're waiting to have a scan. A body ache that might be there for years suddenly becomes amplified. So using techniques like relaxation, breathing, diversion can be very helpful. If somebody has a lot of panic during the actual scan, there are medications that can be helpful. Usually it's a short-acting benzodiazepine. That said, we can also teach people various mindfulness, relaxation, visualization techniques. Sometimes the visualization or self-compassion techniques work better than some of the breathing techniques because you have to stay still in the scanner. Sometimes you can't move. That's why sometimes medication is also good. And then as one waits for results, a lot of cognitive reframing, recognizing where we're catastrophizing, preparing our questions, for the event that there are different outcomes. Shoring up our team, those sorts of things can really help.
Okay, great. Thank you so much. And then we have a couple of questions about resources. So a couple of patients have commented, we're very fortunate to be in a large GTA center with a psychiatrist and psychosocial supports. But what about for people that are, and outside the GTA communities that are really lacking these resources? Are there any free resources for these patients to help with mental health issues?
Right. Great question. And there definitely is an inequity. One of the things the pandemic has done is, because we've shored up virtual care, I find that I'm doing a lot more psychotherapy with people who I may have tried to refer back into their own home communities. previously, but because we were working virtually, that's more accessible. The Canadian Mental Health Association and the Ontario government have some free digital programs available. There is an organization of GP psychotherapists. So I find when I'm looking for a psychotherapist or someone who's familiar with psychiatry in areas where there's not psychiatrists, sometimes I can find a family physician who's got extra training in that area. So it never hurts to start with your own primary care provider and bring them into the oncology team. That's another system. The other thing is organizations like Wellspring. And again, because of the pandemic and putting everything online, I recently checked and I think they have 50 or more programs, including something that's called Meditation to Help You Sleep. So really worth checking that out, because what's happened is programs we didn't even have in Toronto before that are being offered out of Calgary now, our patients have access to those sorts of programs. So there are those kinds of resources as well. And then, of course, there's psychotherapists, but often people have to pay for those people, community psychotherapists, social workers, etc.
Mm-hmm. And then
but
one
if
thing I'm also
really stuck, they can contact the bigger centers and see if they can negotiate a virtual consult, for sure.
And when one thing that came up in the first panel, and also I'm seeing it in the chat here, a lot of people are really concerned that they can't gain weight, and it's causing them a lot of psychosocial distress, right? So you spoke of compassion, and how do patients that are losing weight and quote unquote failing, how do you deal with that failure when you're losing weight and everyone's telling you, well, put on weight?
Right. So I
know
think
that's not
the reason I sighed is it's a big question, right? And of course, multifactorial. And so Teresa will know this, that I teach that there's a primary problem, right? And often there could be a physical reason. And then we add all the layers, right? So we call it, in mindfulness, we say there's the primary arrow, and then there's all the other arrows that aren't necessary, all the other layers that we just add because we start judging ourselves. And so it's worth stepping back and saying, if there was a simple solution, I would put on weight, right? I'm not alone. Everybody who has experienced stomach cancer has likely, or many people, I won't say everybody, but many people who have experienced stomach cancer are in the same situation. I'm not alone. How can I best care for myself? And to be working with, a the whole healthcare team, the nutritionist and a psychosocial provider to help with the anxiety component of that, or at least to help somebody identify the anxiety component so that's something that we can easily deal with, and take that one layer away.
Okay. And Teresa, I mean, you're a part of you're a big advocate for mental health, and I know that you've openly used a lot of the mental health services. Just from a patient perspective, do you have any comments or wisdom that you can share about your experiences using these mental health programs? Oh, sorry, we can't hear Teresa.
Okay. Hi. So definitely I have used mental health resources since my diagnosis 10 years ago. I've done a number of different groups, a number of meditation-based groups, which honestly have saved my life more than once. And one of them, in fact, I've taken two specific groups, programs with Dr. Elliott that were 8 weeks. And boy, do I miss those in-person programs, because they were so helpful to me in terms of being able to ground myself and being able to, not over catastrophize, as Dr. Elliott so eloquently put it, because that tends to happen to me quite often. So I have to say that for me, and I've had a psychiatrist also since the beginning, and he's been incredible. He's, of course, he's listened to me. He's guided me through some very, very difficult times in my life. I think support groups, which is why we started My Gut Feeling, are so crucial to that element that you aren't alone in this. Oftentimes, I can't tell you how many times, both Katie and I receive calls from people or emails saying, "Oh, I wish I had known about you earlier." I'm far into my journey, and I've been feeling so alone. It's been so difficult, and so I feel that support groups are really about that, the mental and the psychosocial. And when it comes to the fact of the keeping weight on, or not losing so much weight, which in my case I did. I lost close to 100 pounds, and I basically became a different person in front of the mirror every day. And it was really difficult for me, although people were like saying, "Oh, you look fantastic," which in itself was difficult for me to deal with, because I know what the price I had to pay for it was. But you feel like you're failing. You feel like you're failing your doctors. You're failing yourself. People ask you, "Why can't you eat?" Or you're not eating enough. How can you sustain yourself? And I think what I've learned over the years is that, again, and I say this almost at every group, you have to be kind to yourself. You have to really know that everyone is different. And some people lose the normal amount of weight, which is about, 20% of your body weight. I wasn't that person. And I know that there's a lot of people out there. But never, ever blame yourself. Never, ever feel like you're failing, because you're not. It is one thing. It's just that your body is basically, I think, taking the natural course it's taking with such a traumatic change physically. And so I think that for me, that was the biggest lesson that I had to learn. And I still learn it. I still deal with all of that. So for me, having the resources was and still is. I still meditate every day. So I use it every day. So I thank those. I thank all those resources. I'm so glad we have them.